learn, teach, and when you get, give. Welcome back to Conversations with Verdel Jones. As you see, we have our first guest here, Dr. Cynthia Quainoo.
Hi.
Quainoo.
I
knew, you know what?
That's perfect. No.
Everyone knows me and names. So as I was saying, March is Colon Cancer Awareness Month. So I'm so happy that you're here to talk about, colon cancer and what people need to do to screen themselves for it, because I think it's an important topic. So you are a gastroenterologist.
Yes.
What does a gastroenterologist actually do? What body parts do you deal with?
Okay, so we basically manage diseases that affect the digestive tract, which include the esophagus, the stomach, the small bowel, the liver, the pancreas, the colon, the rectum. And
that's a lot of areas.
Yes.
And you know what? You're mentioning all of those, and with all of those body parts, there's disease that happens in all of those body parts.
Exactly.
So you address that. What's the Alex Trebek was just diagnosed with pancreatic cancer, stage 4.
Yes.
So you hear these things, and there's so many diseases or things, cancers that people can get.
Absolutely.
So I'm glad, like I said, that you're here to talk about this colon cancer, because colon cancer is curable, right?
Yes. When detected early, it's curable.
Right. Why did you want to become a doctor?
Oh, wow. Out of the desire to help people. Yeah, I decided pretty early on. I think my mom says I was three years old.
Really?
So, yeah.
Wow. And how did you know you wanted specifically working with the digestive system?
So that came later on during my training, during my residency. I had to make some decisions. I was pretty fascinated with the liver early on.
Okay.
It's a pretty complex organ, and it affects the body when it's not well in several ways that people don't even really realize. So through that, I chose
That's so cool. I love this. A woman being, a doctor, it's a male-dominated field.
Yes.
So how do you navigate that with all these, because I work in education. You would think it's not a male-dominated field, but I'm an administrator, and at the administration level, there's a lot of men.
Right.
So how do you navigate that? And being a black woman also.
Right. I navigated it by finding people who are like me, looking for other women, looking for other women of color, either to celebrate with or commiserate with, however you want to look at it.
Exactly.
And also finding mentors that also have
so important.
Similar
Yeah, mentors are very, very important. And I would imagine, I'm making assumptions here, but it is a small community, especially in a specific field, I would think, right?
Yes,
Black women who actually,
are gastroenterologists,
exactly. So that's great. Yeah. So let's get into it. Why are people so hesitant to get screened for colon cancer? I'm not going to say, but why? And why is it important, especially for Black people?
Right.
But first of all, why are people so hesitant to do it?
I think some people have some embarrassment about talking about their rectum or their anus and about bowel movements.
Right.
And, there's nothing really that sexy about talking about illnesses that affect that part of the body.
Right.
So it can be difficult to talk about. But we shouldn't ignore the diseases that affect those parts, because it could be deadly.
It could be deadly.
Right.
You know what? I think sometimes too, it's a matter of being comfortable with somebody to be able to share, those issues with. Because, like you said, nobody wants to talk about that.
Right.
So I think that's I know people are kind of uneasy about that, especially if they're not comfortable with it. And so that brings me to especially Black people. They need to, it's very important for us to be screened as well.
Right.
Why is it, it's important for everybody, but why specifically for African Americans is it very critical for them to be screened?
Okay. So in terms of mortality, I think Black men and women compared to any other ethnic group, we have the highest mortality when it comes to colon cancer.
Really?
And
Wow.
the reasons for that is multifaceted, but mostly
Right.
because we're not getting screened, and a lot of us don't have proper access to health care.
Right, right. And that brings me to like health disparities. There are health disparities, but the interesting thing with that, I know there was a lot of talk recently about, Black women dying in childbirth is more prevalent because not in the socioeconomic status of the Black woman doesn't matter.
Yeah.
So it's that either not being taken seriously or just not being. I don't know what it is. Well, how do you overcome something like that when you have somebody who wants to get the health care that they need, no matter what their socioeconomic background is, they still get into these roadblocks.
Right. Wow, that's a difficult question.
Right, I know.
But namely doing things like this, like for us to sit here and talk, for other
Right.
people to see that we're talking about colorectal cancer and how it affects
Right.
our community, might spark a discussion at someone else's dinner
right.
table
Right.
or a bunch of friends sitting around watching this. So I think it's important to have an open dialogue and talk about these things openly. Racism is a systemic issue that
Yeah,
affects our whole
exactly.
country. It affects healthcare, affects everything. So we have to be also mindful that those dynamics do exist between in the doctor-patient relationship and as well as every other aspect.
And using using your voice,
Right,
being
right.
saying,
Being
hey,
your own advocate.
right, being
Yeah.
your own advocate and having the knowledge, because if you know what to ask for,
Right.
or you'll know what you need to get done. So what are some of the symptoms? But before we get to the symptoms of colon cancer, what are the screenings or the procedures that people can utilize to be screened for colon cancer?
So the most sensitive and the most specific kind of high yield procedure that you can do that's considered the gold standard is a colonoscopy. Okay. So that's the go-to if you're going to pick anything. If you have any other reasons not to do the colonoscopy, if it's like other comorbidities that you have, medical problems that might preclude you from getting anesthesia or something like that.
Right, because they do put you under.
Right. Or if there's any other reason that a colonoscopy can't be considered for you, there are other options that are not as good, but there are other options that you could explore.
Like a scan, and you see always on TV the stool.
The stool
yeah,
test.
right,
as
the
a
stool
commercial,
test,
yeah.
right, exactly.
Yeah.
So, but the colonoscopy is really the gold standard
yes,
for something like that. And when people are screened via colonoscopy, what are doctors looking for?
So we're looking for precancerous growths or polyps or abnormal tissue growths that can occur in the colon.
Okay.
But the colonoscopy, you can simultaneously take those things out while you're doing the procedure.
Right.
Or you can even biopsy other abnormal looking tissue if you need be.
While you're in there.
While you're in there. Exactly.
Get it all done.
Right, exactly, in one shot.
So if you have polyps, because I hear that expression, when people get colonoscopies, they find out they have a polyp. Does that mean that you're eventually going to get cancer, or is it like, what does that mean?
So if the polyp can be successfully removed, then we've abated we've decreased your risk somewhat. But you have to undergo a surveillance that's more aggressive than someone who does not have any polyps. So if you got your first colonoscopy done and you had no polyps, it was completely normal, you can reasonably repeat your colonoscopy in 10 years.
Really?
Yes. If you have one polyp, two or three, up to three polyps, if you have one or two polyps, you repeat in 5 years.
Okay.
If you have three or more, you repeat in 3 years.
Really?
And obviously if you have some type of genetic problem and multiple polyps, then other testing has to be done and you could get your colonoscopy more frequently.
Interesting.
Yeah.
Very interesting. And people don't like the prep.
People don't like the prep. They don't. Because it involves you depriving yourself of food for a half a day and then drinking a large volume of solution that causes you to have diarrhea to flush out your system. But there are new, low volume, more tasty preps, if you will. But I mean, the end result is the same. And,
Right.
It's just something you have to endure.
You have to get it done. And what age should we get our first colonoscopy?
So for Black men and women, it's been the guideline that it's 45 years.
Wow. Yeah. And why is that? Because of the prevalence of it in our community, or?
Right.
Okay.
Absolutely.
Okay. So, say for example, as I share with you, I had my first colonoscopy. I think it was 45.
Right.
I had some stomach issues, and the doctor said, "Let's do a colonoscopy," which is which is great. The gastrologist, or it's not gastrologist, it's gastroenterologist. I just say gastro
You can say
doctor.
GI for sure.
GI, yeah, thank you. He ordered a colonoscopy, which is great. Because some doctors may have let that slide, but he went on and said, get this done. But what are some symptoms that people can look out for in reference to colon cancer?
Okay, so blood per rectum, having blood when you wipe or blood in your stool. I think we, at this point in the game of the disease, we've kind of passed the point where we can write this off as having hemorrhoids. It's not appropriate. If you have blood and you haven't had it before, you should do something. You should get it, examined. That should be looked at. Having abdominal pain, weight loss, a fatigue from anemia. But these are all symptoms that would occur if you have kind of like an advanced stage cancer.
Okay.
A lot of the early stage cancers and the polyps, you wouldn't have any.
Won't know.
Right, you wouldn't know. You wouldn't have any symptoms. So that's why it's important. Even though you feel well, everything's going great, you still need to get screened.
Wow. So it could be laying dormant. You don't even know.
You don't even know.
Wow.
If you have polyps,
Now, can diet and exercise help you be colon cancer free?
It can help decrease your risk for colon cancer.
Okay.
So even if you're doing all the right things, you still need to get screened. But diets that are high in red meat, high in processed meats have been associated with higher risk of colon cancer. Exercise, sedentary lifestyle has been associated with colorectal cancer.
Interesting.
So, and the lack of exercise will lead to the obesity, which leads to diabetes, which is highly correlated with colon cancer.
Is that right?
As well. Yes.
Oh, that's why in the African American community it's
right. So we have a lifestyle issue.
Wow.
Right? Yeah.
So you educate people around these topics. So how can people, if they want to get more information, how can they reach out to you? How can they, because I would love to see, I'm sure you do, you speak everywhere about this. It's such an important topic. So how can people reach out to you?
So I'm at Brookdale Hospital. My office number is 718-240-6025. You can call for an appointment.
It was a pleasure meeting you.
It was a pleasure talking to you.
Thank you so much for being here. Thank you. We're going to take a quick break, and when we come back, we will have our next guest. Thank you for watching Conversations with Verdel Jones.